I have the privilege of chairing this with Dr. Marav Leba from Israel. And we actually have kind of a mixture of things in our particular oral session. So ranging from an update on MRD data from the MYELOMA XI trial. So this is a trial, a very large trial from the United Kingdom that previously showed lenalidomide maintenance actually benefited all patients, even those with high risk, although not as much. But what they're presenting in our session is actually MRD data, which not surprisingly, as if you've seen a lot of this, is MRD negativity rate, particularly if determined at 6 months after a transplant, if that was your assigned arm, you actually had a significant reduction in both chances of relapsing and also survival. And so I think this is, again, underscoring how MRD seems to be an important surrogate for how a patient will do. And I think there are many abstracts here that are going to be looking at MRD negativity rates as part of other trials, and this is just one of them in our session. We're also going to be looking at an abstract that is comparing circulating tumor cells with bone marrow plasma cells in a number of patients, trying to see if there's any sort of molecular differences. This particular investigation didn't really show that there were different clusters of differentiation, but they did show that there seemed to be a correlation between bone marrow plasma cell proliferation and the number of CTCs. And so there are quite a few presentations here at IMW that are looking at CTCs, not to mention the number of abstracts that are going to be incorporating MRD analyses as well. One of the most exciting presentations is going to be led by Dr. Sagar Lonial, where he is updating Iberdomide combinations, Iberdomide being a cereblon E3 ligase modulator or CELMOD drug. It's been presented in combination before with both daratumumab and bortezomib, most recently at ASCO. So what he is presenting at this workshop is data with carfilzomib. And this also looks like a very good combination in patients who are previously treated and actually progressing within 60 days of their last treatment. So I think this is going to be a very big presentation as well. There's also a very interesting presentation from France in our session where they're looking at actual therapy delivered in a large number of patients throughout France. And I think it's very eye-opening about what patients are actually getting treated in a real-world situation, with most of them getting a thalidomide combination up front and second line being Lendex. It'll be very interesting to look at this in terms of the differences between what we might see in the United States versus elsewhere. So those are just some of the highlights of the session. I think it's going to be a very good one. I think there's going to be a lot of discussion at this meeting as well about the role of CAR-T. There's going to be some updates in both data from the CARTITUDE-1 and CARTITUDE-2 trials. That's using cilta-cel as the CAR-T product. And also there is going to be an update with ide-cel. I think there's going to continue to be a discussion going on right now if you can really show that one product or one CAR-T approach is superior than the other. I know there are people who think that's definitely the case, but I think we're just waiting to see all this data mature, particularly from the trials that are using CAR-T intervention earlier in the treatment course.